Hey guys, so I'm here to update you a little bit on the trying to conceive journey. I literally have barely any information for you. Right now it is July 5th, and that is, I should have had this like figured out ahead of time. 1, 2, 3, 4, 5, 6. 1 day short of 6 weeks after the miscarriage. I have not gotten a period yet, so we're waiting on that. I am cramping as of the last 5 days or so. Here and there I get some cramps. They are getting a little heavier today. I've had, they probably last about a minute or so at a time. So that's happening, so I'm hoping a period is coming. I have pretty much taken a back seat to actually trying to conceive right this second until I get a period. The reason being, I am getting positive and negative pregnancy tests. I had a doctor's appointment with my OBGYN on the 22nd. June 22nd, I had another PAP done, and since it was about a month after the miscarriage, so I had a PAP done. I'm waiting on those results. I go back on the 20th of July to talk to him about that. So we're testing that. I did have my blood drawn, I want to say it was Monday the 20th of June. If not, I had it done, nope, I had it done Friday the 17th, and I found out on Monday the 20th. And that was where my HCG was -2, my progesterone was 0.5. So I clearly was not pregnant, and according to my midwife, I hadn't ovulated yet. Based on the levels that she saw from my pathology report, I had not even ovulated yet. Now, when I went into my doctor on the 22nd, I did have the proper cervical mucus for ovulation. I don't really monitor that a whole lot when I'm trying to conceive, but in the last couple months or so, I was starting to try and see if maybe my body was naturally telling me, instead of using ovulation strips, maybe my body was going to tell me when I was ovulating or about to. So I noticed that I had the proper consistency for ovulation, and I took advantage of that, but not like, I mean, I would rather wait for a period to come so that I can calculate properly the age of the fetus and everything. So it was like a, hey, if it happens, it happens. If not, no big deal. So I had that happen, and I got a positive pregnancy test sometime last week. Somewhere around like the 29th or 30th of June, give or take a day, I'm not sure, but I know I had a positive. Now, when I say positive, it's faint, but it's there. And it is within the time frame of that specific test. It's always important, read the test instructions. No matter what the brand is, read them, because they differ from every single brand. And I was using the 88-cent purple ones from Walmart, and I got a light faint positive within 2 minutes, and you're not supposed to read them past like 5. I have some that I've taken that you're supposed to read them between 5 and 10 minutes. So read the tests so you know when to look and when to stop looking at it. So I did get a faint positive within 2 minutes on that test, and I was a little worried, and I didn't get it because, okay, I was back down to -2 HCG. I'm not pregnant, but now I was getting negative pregnancy tests after that. So I started my ovulation strips again. They started to be positive consecutively. I was confused because when I was pregnant this last time, I had all positive ovulation tests. I took the pregnancy test, it was positive. So I was like, why are all of these ovulation tests positive? So I took a pregnancy test, came up with a faint positive, and then I waited, I want to say 2 more days. I waited 2 more days, and then I took 2 different brands. They were from the dollar store, so they were 2 of the really cheap little white ones, but they were 2 different brands, and I took both of those. And one came up faint positive, but it was after the amount of time. So the one, you weren't supposed to read it past 10 minutes, and it came up a faint positive probably 15 minutes after I took it. And then the other one, absolutely negative, stayed negative, still is negative. So what do you do? Like, how do you suspect anything? Where do you go from there? So because I'm not in a super rush, because I would rather have a period before we start tracking everything, I'm just gonna wait till I see my doctor on the 20th, and then I'm gonna see if maybe he'll pull my blood and we'll see what's going on. Because any other person out there who doesn't have fertility problems would look at a faint positive and say, oh, I'm pregnant. Faint and false positives are very rare. They are. So the fact that I'm getting positives but negatives, and then positives but then negatives again, how am I supposed to know what my body's doing? So even though my HCG hormones have come down and they're fine again and I can start to ovulate again because they are under 5, I just don't know what's happening with my body. So I was doing a little bit of research. I looked at probably about 7 different websites and a bunch of forum posts based on other women who had similar issues with waiting on their period after miscarriage. Every single body is different, but the majority of articles and the majority of women got their period within 4 to 6 weeks after their miscarriage. So I'm giving it 1 more week to see if Aunt Flo comes along. If she doesn't, I got a problem because I don't know what's going on with my body. My OBGYN told me that, 3 months after my miscarriage, if I don't end up naturally pregnant, he's going to put me on a medication to shorten my cycles and try and get me on a regular ovulation and period cycle. I'm at the point where if I don't get my period by the 20th, I'm going to get some blood work done, and then I'm going to tell him, I don't want to wait. Let's just put us on that. Just put me on the medicine so that I can start having normal 28, 30-day cycles instead of 41-day cycles. That way we can kind of pinpoint what's going on and shorten them up. That's kind of all the information I have right now, up until I go see him later this month. So I will let you guys know if Aunt Flo comes along. But until then, I don't really know what to say, because anyone else would be like, oh, I'm pregnant. I don't think I am. Like, I don't have any signs or anything, but I'm getting faint positives here and there. So it's all a mess. It's crazy. I don't know what's going on. I don't know if my body has regulated or not regulated or what the heck it's doing, but that's the moral of the story for this update. If you guys have had similar issues, feel free to share your information with me. Feel free to tell me about similar, friends in your life or family members who've gone through the same thing. I don't know what's going on. So I guess we'll get more information in, 15 days or so when I go see him again, and I'll update you then. If anything else happens before then, I will be sure to let you know. But until next time, I'll see you around, and thanks for watching. Bye, guys.